I'm Steve Duckett. This is part two of a demonstration of a powerful but surprisingly easy method to model and simulate the spread of COVID-19 in the US. A spreadsheet application like Excel is actually a higher order language that is well suited to model complicated problems like the spread of an epidemic. Since many people are familiar with spreadsheets, they provide a powerful do it yourself way for the non expert to gain insight into the dangers and timing of the epidemic and into the often confusing decisions regarding mitigation that we need to make as citizens. In part one, we did a number of simulations and we showed that even a few columns of figures could model a remarkably complex result. We started with a nursing home, about 50 people. We expect that because of comorbidities and compromised immune systems, that 85% of those infected would be in the severe column. And we showed that just an initial seed of just one person uh, soon gave rise to a really ugly result. Quickly, everybody in the nursing home was infected if there were no mitigation. And between the first death and the 14th or 15th death was only about a month. So that's one of the reasons that this caught people by a great surprise. Since about a 0.5% of the US population is in nursing homes, if all of them got infected with no mitigation, we'd have 500,000 people dying before their time. A really ugly result that shows that mitigation is critical, and so is trying to keep people away from being infected. The next scenario we worked on was, let's say, a city of a population of 1 million or so, and we expect in that case that most of the people are fairly robust. We have 1 million. And we said because of so much traffic, air traffic coming in, let's say from Europe and Asia, 200,000 travelers in 1 month of January in New York alone, that we'd start with about 6 people, which is probably quite conservative. But in any case, let's actually put in the six. And so we're talking about an extrapolated number. If the whole US were composed of granules of 1 million people, there'd be 200,000, a quarter of a million people who die because of this. We also showed in the simulation that if you didn't go all the way down in this mitigation here and relaxed too soon, why just a 40% relaxation um, would give rise to a tremendous change in the number of dead, going from a quarter of a million to 750,000. So 500,000 more people are at risk of dying if you release the lockdown too soon. So next we'll go on and look and see what is actually going on in these columns so you can do your own simulations if you like. We can look a little more closely at the assumptions and calculations of this model. As we talked before, we've got a timeline and we have five sort of columns which are the states of people at any one time, those that never been infected, those recovered, mild, severe, etc. The numbers up here with labeled mild and severe are essentially uh, the guts of the calculation. They're all based on R0, R naught, which is the total new infections per infected person, the replication rate, the reproduction rate, the infection rate, whatever you want to call it. Since we're going by steps of 1 week, uh, and most of the people will last 2 weeks in the model, why the new infections per week are about 1.35 in order to come up over the lifetime of the person in the situation of 2 to 3. We picked these numbers, by the way, to be what has been seen in places like Italy, New York, Wuhan, etc. We assume also that the mild people recover fairly quickly. They will take less than 2 weeks in the situation, whereas the severe people will last somewhat longer. And of course, some of them will go into the dead column. Some of these will go into the recovered column. Uh, Perhaps it would be good just to take a look at what we've got here. Maybe 100 would be a better way to look at things. And we see that out of the 100, we get 135 new cases, of which some of them go over here. 20% of the 15% of the new cases go over here. Over in, this is hard to see because of the other stuff, 60 of them, uh, uh, 0.6 times 100, recover. What's left in here of the original 100 that drops down is only 37, but added that to the 85% of the 135, and it adds up and gets bigger and bigger. Now, one thing that we need to remark on is that the calculation is what a mathematician would call Markovian. That is to say, this number here, let's take this number here. It comes from just these two numbers here, okay? It doesn't take into account that it's possible that some of the people in this number here came all the way down from this point or from here, whatever. It only looks at the prior state of the system, not how people got into that prior state. It means, therefore, that it's harder for us to model something where somebody could remain sick for 3 weeks, but no longer be contagious after 2 weeks or so. But the number of people that last the third week are fairly small, and I don't believe that it will change the simulation substantially. It certainly doesn't in certain physics problems that I've been associated with. Well, notice over here, this is the isolation factor. It is essentially the multiplier of R0 due to the fact that you've reduced the number of contacts, you've quarantined yourself, people are doing other mitigation strategies, staying 6 feet away, etc. And we're hoping to get that number down to less than 20% of the original R0. Certainly in Korea and in Wuhan, that has been attained, and the infection has been pretty well quenched. Whether we can do that in the US with all of the cries that it's killing us economically and we've got to relax, etc., that's something that is imponderable at this point. But if you do manage to get it down to zero point 0.2 and then relax, not quite up to where you were before, you still keep some distancing, some mask perhaps, wash your hands more often, etc. So it's not quite business as usual, but it's it's enough to relax things economically with a modest amount of hardship. And if you do that, you can get the scenario like we have over here, where you rise up and peak, and then you have subsidiary peaks as you relax the strict quarantine and social distancing. I put in here also a column for medical capacity. The essentially 200 is more or less the number of ICUs and ventilators and things that are necessary for the COVID per million people in the U.S. Some places are doing better than that, and every place is trying to increase its capability. And I put in here a simple increase factor. Here in Santa Clara County, where I am now, why probably we're about 350 um, per million population, but most places are that, and smaller communities are obviously a lot less. And if we put in here a reasonable number, let's say six, that were infected, you see that in this particular simulation, why we're starting to get above 200. And at that point, there are some equations in there that increase the death rate over 10% of the severes per step. A reasonable sort of simulation. It doesn't change things drastically, but it certainly increases the death rate, as you've seen in New York, and the sad situation where people were parked out in the corridor, essentially to die, etc. So this is what I call the lockdown and release scenario, which is actually found over here. And what happens is that this cell essentially grabs them from whichever one of these scenarios that you're talking about. This I call the TP scenario: toilet paper, Trump pens, take your choice. And this is a no mitigation or very little mitigation, which was the case, let's say, for nursery homes in Washington State to begin with, when nobody really knew what was going on. We hope that today in the nursing homes, the people will be much quicker to start mitigation, even though it's very difficult because people are all crammed together. Uh, but it's really necessary to figure out a way to do that because, as we pointed out before, half of 1% of the people are in nursing homes, and if you get 33% of death rate, well, we're talking about 500,000 people that die before their time. So, okay, I think this is a reasonable description, and you'll notice, of course, that there are other notes attached to every cell that has a little red marker here, and you can follow those. I intend to put this model attached to a website called bouncerflies.com, so you can look for it there by around the 25th of April. Uh, do take care. Thank you for watching, and have as good a day as you possibly can. Bye now.